Dr. Paul, I'm concerned about Mr. George's medication regimen. He's taking multiple medications for his heart condition and diabetes, and I'm worried about potential drug interactions.
That's a valid concern, Mihira. Let's review his medication list and identify any potential conflicts.
I noticed that he's taking a combination of blood pressure medications and a diuretic. This combination can increase the risk of hypokalemia, or low potassium levels.
You're right. We should monitor his potassium levels closely and adjust his medications as needed.
Additionally, Mr. George is also taking an over-the-counter pain reliever. This could potentially interact with his other medications.
That's a good point. We'll need to evaluate the risks and benefits of continuing the over-the-counter medication.
I've also noticed that Mr. George's medication list has changed several times in the past few months. This can be confusing for patients and increase the risk of medication errors.
You're absolutely right, Mihira. We should simplify his medication regimen as much as possible. That's completely understandable, Mihira. It's not easy to help someone quit drinking, especially when they may not be ready to take that step. But you're not alone in this, and there are several options that can make a real difference. A medically supervised detox program can help him quit safely, minimizing any withdrawal risks. Counseling, whether individual or group therapy, can provide emotional support and address the underlying reasons behind his drinking. Support groups like Alcoholics Anonymous can also be incredibly helpful, allowing him to connect with others who have faced similar challenges. Encouraging small lifestyle changes, like engaging in new activities or routines, may also help reduce his dependence on alcohol. Most importantly, I strongly recommend involving his doctor to ensure he gets the right medical guidance and support tailored to his needs. Would you like help in exploring these options further?